Okay, just get rid of the window so I can see. Um, so I'm Kylie after all that big introduction. I am, oh, I'll just go back to this. Oh yeah. So it's really lovely and a privilege to be with you all. I've been hearing about all the things that have been going on over in your part of the world, and we are also experiencing challenges similarly. We have a national disability insurance scheme, and it's constantly throwing challenges up for our parents and children, and it's always a moving feast, and it's hard to keep up, and it's hard to advocate constantly, not just as parents but as clinicians and uh, workers that support people through the challenges that we experience. So I'm actually in Perth at the moment on the other side of Australia for a conference, which is the Australasian Autism Conference. So I'm really pleased that I could be present with you today. If for any chance I have a 7-month-old baby who will be arriving back here shortly, so hopefully she doesn't throw up too much distraction for us all. I am finished my PhD on the understanding parenting related traumatic stress, particularly for parents of autistic children. And what I've done today is basically put a mishmash of the findings together. And then what I'll do is finish off with some of the things from a clinical perspective, what I've found some parents that I work with have found really helpful. And basically a lot of them are just kind of little strategies that you could use kind of in the moment, because we know as parents, it doesn't sort of stop. You don't get a chance to breathe and go and do elaborate therapy and get support. So some of the things that I found most helpful for parents is to just have those little micro strategies that you can, experiment with and find something that works for you. So I hope, please feel free at any time if you have any questions. I don't know, Michelle and Diane, if you're fielding questions or if how you want to work it with questions that come up.
We have put a Google chat into, or excuse me, form into the chat so people can turn in their questions. Because we wanted to make sure that you can get through your material and
Yeah, great.
we'll come back to
Okay,
it.
perfect. Okay, that's awesome to know. So I guess a little bit about me is a recent family photo. So I am a late diagnosed autistic ADHD mother, wife, sister, daughter. I practice as a clinical psychologist, but yeah, I do have a background in music therapy, which I think gives a bit more of a play, creative side to being a psychologist. And yeah, I did my PhD on traumatic stress in parents of autistic children, and I'm fascinated by this area of research. Um, it has not always had a great rap, I guess, because it can be quite triggering for some parents. But I'll go into that as we get into the slides. Um, so basically, the things that I looked at were parenting related traumatic stress and what that looks like. So from what we know is that some parents experience similar symptoms to post-traumatic stress, but we still don't really know a lot about how common these symptoms are and why they're often under-recognized, and particularly like what experiences may trigger these symptoms and what may help parents cope. Which the later of that we don't really know yet, because parents are such a unique population. And yes, we have coping strategies for trauma in general, but do they help parents, and do they help parents that are in the go all the time? So some of the coping strategies I'll talk about have been things that we've kind of had to trial and error in sessions with parents, and they can be very unique. So not the same strategy is going to suit the same parent. So hopefully we'll find something that each of you may sort of resonate with. So I guess before going into the thick of it, I just want to just emphasize the point that autistic children are really all unique and valuable, and I feel that they're deeply deserving of their place in society, and that parenting an autistic child can be a rich and meaningful experience. And I guess the aim of my research and what I'm going to talk about isn't to pathologize parenting, but to basically ensure that when challenges do come up, that we have the right supports and that they're available and they're accessible. And I guess it's also important to mention here that many parent health, like mental health difficulties, do stem from the mismatch between society systems and the needs of autistic people rather than autism or, neurodivergence itself. And I also just want to say that some of the content may bring up strong feelings or memories or thoughts for you. So if you are finding that you're resonating with a lot of this stuff and it's kind of getting a bit overwhelming, I want you to please just make sure that you take care of yourself. If you need a break, step out or tune out, or I'm sure that this is being recorded so you can jump back in and if you miss anything. And I guess I'm not sure what here in Australia we have numerous helplines. I don't know what you would is there a parent line or some other trusted support that
There is not a like a universal parent helpline, but there is a mental health
okay,
number of
cool.
988.
Oh, okay, cool. Yeah. So that would be great. Just if you do, because I know sometimes you don't anticipate these things will happen, but especially when you're in the thick of it as a parent, some things can stir up feelings. So I hope that this doesn't do that for you, but I also hope that it brings some understanding and validation for you all. So I guess jumping in, what do we know about parents of autistic children so far? Well, we know that there's no shortage of research showing that parents of autistic children experience much higher levels of depression and anxiety and stress than other parent groups or just general people in the population. So, for example, a large review from 2020 looked at 36 studies involving over 9,000 parents, and they found that about 1 in 3 of those parents experienced depression and similar numbers for anxiety. So, and in comparison to the general population, the rates are closer to 5% of the population, or 4% for anxiety. So it's much higher for our parents than general society. What's really interesting is that in that study, trauma conditions couldn't even be estimated because no studies had actually measured them at all. So depression and anxiety have been more commonly studied and recognized in parents in autistic children, probably because they're better understood and they tend to carry less stigma. So it kind of, for us, it really raises the question, well, if there's so much depression and anxiety, why are there so few studies looking at trauma in these parents? So I guess in thinking about that, when we talk about trauma in the context of parenting, it's a bit more complex than talking about things like depression and anxiety, because the word trauma carries a lot of weight. It can sound like we're saying something harmful has happened. And if we use that kind of language without thinking about how well the systems around parents and their autistic children actually support them, it can be misunderstood. So it's like we're saying the child or autism itself is the cause of the harm. And that's understandably confronting and can feel deeply stigmatizing. But I guess looking at the data that we have, we can't really ignore that complexity anymore. It's not going to cut it for a lot of parents. And I think as Michelle said, you're starting to, connect the dots here that, hold on a second, it's not just anxiety and depression that we're experiencing. So I guess before we launched into this research project, we wanted to understand what was already out there about trauma in parents of autistic children. So we reviewed all the available studies that had used trauma measures or structured interviews. And no surprise, there were only really 7 studies worldwide, and they were coming from mostly the US, Australia, Canada, and there was even one random one from Turkey, which had collectively around 1,700 parents. And the trauma rates varied a lot from, as you can see, 14% up to, there was one that had 63% of parents had post-traumatic stress symptoms. So on this slide that you're looking at, I've only shown 3 studies in the orange, and I've only shown those because they specifically focus on parenting-related traumatic experiences, like things that happened while in the process of caring for their autistic child. All the other studies basically focused on just general trauma, like natural disasters or assault. So these 3 were the most consistent, showing rates around 20%. Compared to the general population of 5.6%. So I guess while the research is really still limited, it tells us something really important, that traumatic stress is a real experience for many parents. And so I guess, but for parents of autistic children, the stress really isn't about one single event. It's more about chronic, intense, and emotionally exhausting events that happen over days, months, years. It might involve frequent meltdowns, self-harm behaviors, constant public judgment, or the ongoing struggle to access appropriate support, which I'm sure you can all relate to. So over time, these experiences can feel really threatening and profoundly overwhelming, and can lead to the same kinds of traumatic stress symptoms that we see in post-traumatic stress disorder. But because these situations that you're experiencing don't always involve an event that's formally recognized as life-threatening, they're often overlooked or described as just general parenting stress rather than trauma, which is an insult, isn't it, at the best? So I guess, like, moving on and having a look at some of the symptoms. I know it's this is a bit dry, this bit, but it's important to understand, because I guess, like, you guys in America, you subscribe to the DSM, which is like the diagnostic manual that most clinicians would use to diagnose, you know, autism or PTSD, or and in Europe there's a system called the ICD, and that is slightly different in the way it recognizes different disorders. So when we're looking at PTSD, there is the common criterion A, which is the event, the trauma. And then after that, there's a whole bunch of symptoms. So the DSM-5 has way more symptoms for PTSD than the ICD, which only has 6. DSM has 20. But the thing is that's different is in the ICD, they have what's an addition of complex PTSD, which that's basically PTSD with extra frills. So it's additional symptoms of managing emotions, feeling a stable sense of self-worth, and like being able to maintain relationships with your loved ones. So if you're experiencing symptoms of that kind of nature, and if you have ongoing stress, then you're probably more going to resonate with the ICD, complex PTSD, which in Australia, that's quite challenging because a lot of people only use the DSM. And I think it's kind of similar for you guys in the US. So because of these differences, what we wanted to look at is how trauma shows up in parents of autistic children, and how does it fit in both of these systems? Because I guess if you're being assessed with one system, it might miss you for certain symptoms that you might otherwise better fit with. So these are the basic questions we were asking and wanted to kind of get some answers for. So generally, how common PTSD and complex PTSD are, which is the better system for us, and what factors basically increase the chances of us developing traumatic stress. So in that, we basically designed a survey. It was a massive online survey. And the reason why I was in Denmark and Australia is because I had half of my PhD was at Copenhagen University, and they have access to population-based data, which is wow. So in Denmark, we sent out the invitation to, I think it was like over 20,000 people in the population. And we had about 3,000 parents take up the invitation. And about half of them, about 1,370, were parents of autistic children. In Australia, it was a little less because we don't have those population-based registries. We had to do it through like good old Facebook and social media and community and things like that. So of that sample, we got about 459 parents of autistic children. And we used some of the common checklists to pretty much figure out what their traumatic event was. And then we used two different measures, one that went with the ICD to check their symptoms according to that. And then we used one from the DSM to check the symptoms against that criteria as well. So what I'll do is I'll just go through the findings just so you get an idea of what this looks like. So when we're looking at the prevalence, so how common it is, what do you think we found in terms of, is it higher in parents of autistic children? And the answer is yes, definitely. We already knew that from the get-go. So it's a resounding yes. So if we're looking at, I know a lot of numbers on this page, but if we're looking at the DSM, which is both Australia and US basically, we found that in the Denmark sample, we had 6% of Danish parents and 16% of Australian parents met criteria for probable PTSD. And the reason I say probable is because to get a diagnosis of PTSD, you actually have to go through like a clinical assessment. But for us, we basically did it online. So we have to say probable. So in comparison, the rates for parents of non-autistic children were much lower, about 2% in Denmark and 4% in Australia. When you look at the ICD, which uses, again, it's a narrow trauma definition, the rates dropped slightly to about 2% in Denmark and 3% in Australia, compared with less than 1% parents of non-autistic children. So when we included complex PTSD, it was very interesting. Again, so complex PTSD captures the more ongoing or repeated types of trauma. We found that the rates rose. So around 4% in Denmark and 12% of the sample in Australia, compared to less than 3% in the non-autistic parent groups. So I guess in answering our question, so regardless of the diagnostic system or the country, it was quite clear parents of autistic children experience trauma-related symptoms like several times more often than parents of non-autistic children. And while the rates were higher among the Australian parents, it likely reflects the differences in sampling. So the Danish data came from the population, whereas our Australian data, we only had like a really smaller kind of participatory volunteer sample. So you're more likely to get people that were really invested in the research that were already kind of experiencing those symptoms, basically. So that's basically answers our questions about prevalence. It's a lot more than what we thought. So if we look at the traumatic event, what we found, sorry, getting a bit lost in my thoughts here. So if so many parents are showing these traumatic symptoms, what kind of events are actually being recognized as professionals as traumatic? And are we missing some of them? So to explore this, we looked more closely at the parenting experiences that parents described as most distressing or overwhelming. So things like medical crises, aggression, moments where they fear deeply for the child's safety. And here's where it kind of gets a bit complicated. Because whether those kinds of events are recognized as traumatic actually really depends on how trauma is defined in our ICD and DSM systems. And that's what psychologists, psychiatrists, GPs basically use to determine, do you have traumatic stress, or is this anxiety or depression? Um, so that definition again is called criterion A in the diagnostic systems. And it plays a really big role in who gets recognized, diagnosed, and supported for trauma. So I guess before I show you what we found when psychologists rate these parent events, let's just take a quick look at why this definition matters so much. So in our research, we found that the definition of what counts as a traumatic event, so AKA what psychologists, psychiatrists call a criterion A, may be one of the main reasons so many parents aren't being recognized and supported for trauma. So I guess you can think of criterion A bit like a gatekeeper system. For someone to be diagnosed with PTSD, their experience has to match the kinds of examples listed in the manuals. So things like war, assault, or natural disasters, which, yeah, that doesn't quite fit for us. But when distress comes from the ongoing and emotionally intense experiences of parenting, like repeated medical emergencies, aggression, constant fear for the child's safety, these experiences don't often fit these categories. So even when parents show clear signs of trauma, they can be told that they just don't qualify. And that has real consequences, not only for the diagnosis, but for access to trauma-informed care and funding. And that could really make a big difference for some of us. So this raises a really important question. If the definition of trauma is acting as a gatekeeper, how much do psychologists and psychiatrists actually agree on what counts as a traumatic event for parents? So let's just take a little look at what we found. So our first question, basically, do they agree on what counts as a traumatic event? And I'm guessing that your guess is what my guess was, and it is no, they actually really don't. So across both systems, the DSM and the ICD, psychologists only agreed about half the time on whether a parenting experience met the definition of trauma. So that's about the same as a coin toss. Many of the events that parents described in our study just simply didn't fit the kinds of examples listed in the criterion A in the formal diagnostic systems like war, assault, or natural disasters. And I should say that when we use psychologists to rate the parent experiences, all of the parents that they rated their experiences had already met the threshold for symptoms. So they were all showing traumatic stress symptoms to the point where they could get a traumatic stress diagnosis. But they didn't make the diagnosis because the psychologist or psychiatrist didn't rate them as meeting the event, the traumatic event. So another possible reason that we know that this might be happening for psychologists is that it's called diagnostic overshadowing, where the experiences are normalized as just a part of parenting an autistic child rather than being recognized as potentially traumatic. So I guess like the interesting part of this was that the ICD recognized more parents. So it has more, it's more consistent in capturing experiences than the DSM. So this all points to a bigger issue that the current trauma definition may simply be too narrow, and that we might need to think beyond criterion A to understand the kinds of experiences that can lead to trauma symptoms in parents. So I guess, you know, if you're under the DSM criteria here and you're being assessed for PTSD, you might not necessarily qualify for us. So I guess if we're moving on, that was the criterion A part of PTSD. Now we're looking at the type of symptoms that parents tend to show and what that means. So even when parents clearly describe distressing or overwhelming experiences, the current systems don't always recognize them in the same way. And that means that we risk missing the bigger picture, what these symptoms actually look like for parents. So next we turn to look more closely at the symptoms themselves, both the DSM and ICD systems, to see how these patterns of trauma symptoms actually present and whether the same symptoms that define trauma also capture their lived experience accurately. So just before we go into what we found, have a quick refresher on the symptoms. So again, the DSM has more symptoms and the ICD has less, whereas the ICD has the complex PTSD. The DSM doesn't account for the symptoms of complex PTSD, like the long trauma experiences, the ongoing nature of it. And so while the DSM, it basically casts a wider net, it doesn't kind of give a clearer picture as to what's actually happening. So if we go into what we found, it was the same as the previous findings. Like the ICD recognizes how it recognizes more parenting related events. We also found that the ICD actually fits parents' symptoms better. So it captures their symptoms better than the DSM, which the way we fitted the models didn't really account for what parents were experiencing in the DSM. It didn't capture what they were, the different things that they were going through, whereas the ICD did. So, and I guess that's because the complex PTSD. So what we found is that fit parents much better than PTSD, which was really interesting. So it means that alongside like the more familiar symptoms of PTSD, like, reliving distressing memories, being hypervigilant, just always on, always switched on, the avoidance of certain things that trigger distressing thoughts and feelings, or feeling just always on edge. So many parents also, in addition to those things, reported deeper ongoing challenges with managing their emotions, just kind of feeling like it's always up and it's always down and you can't control the storm within you, feeling very self-critical. Oh, my slides are having a moment of their own, and struggling in relationships. So together, these are known as like the disturbances of self-organization. That's the particular cluster of symptoms that make complex PTSD unique from PTSD. So I don't know if any of this is resonating with you as parents, but definitely as a clinician and working with parents, finding that PTSD didn't necessarily fit the parents I was seeing, but these symptoms did. So I guess like this is important because the ICD system basically recognizes that trauma can develop not only from one shocking life-threatening event, but also from long-term repeated stress. And it's interesting because I think a lot of people think that complex PTSD is a childhood disorder. Basically, you only get complex PTSD from having trauma in your childhood. But the ICD basically stresses that you can have complex PTSD from chronic stress that you experience in adulthood. And this is kind of quite similar to the ongoing caregiving pressures that, us parents can experience from like our particular experiences. So interesting, that one. So I guess, and if you have we have a quick look at why the ICD fit better. I guess because it focuses on fewer symptoms and it categorizes them better. So, your PTSD and your complex PTSD, they're two different things, whereas DSM tries to capture it all in one big diagnosis, which doesn't sort of, we found doesn't fit our parent experiences. So parents who kind of struggle with the emotion regulation, self-worth, or the relationships, if you're assessed under the DSM criteria, you might get overlooked or mislabeled as anxious or depressed. And that doesn't sometimes help us. So I guess when in our study, when parents anchored their symptoms to a parenting experience, their patterns more closely aligned with the ICD. And we are thinking that that's because it includes complex PTSD. So I guess once that's all the heavy hitting stuff, all lots of numbers. I hope you're all still going okay there. So I guess once we sort of understood, okay, what is it about PTSD and complex PTSD that fits our parenting population, and how common it is, we kind of wanted to get a bit of an understanding of what might predict it. So what sort of things in the environment make that more possible that we will be likely to experience trauma. And I'm pretty sure that we don't need the research to tell us, but if policymakers and big important people, they need the research to tell them. But us as parents, we probably, the things that are coming on the next slide, you will probably already be like, so if we have a look at what our research told us in a nutshell, parents who have poor sleep, particularly, we used a generic sleep questionnaire, and that was significant. But what was more significant was worries about your child that keep you from sleeping. That was one of the most powerful predictors of traumatic stress, so poor sleep, past trauma experiences. Oh, hold on, where are we? I don't want to tell you the wrong things here. So we have poor sleep. So sleep is disrupted by worries of your child and general sleep. Also, parents who had higher sort of child behaviors of distress. So when I'm talking about child behaviors of distress, I'm talking about, your meltdowns, your difficulties fitting into schools and systems, and like all those kind of behaviors that you see your child doing when they're trying to communicate with you that this doesn't work for me. Please take me out of this environment. I need to calm down. So if you have a child that's in a system or that just doesn't quite fit, you'll be seeing more of these behaviors. And the parents that were engaged in our survey, that was one of the highest things that predicted whether they would experience traumatic stress. So I'm guessing I can't see all of your faces, but I'm guessing that perhaps most of you have children where they just don't fit in the normal neurotypical systems. And so you probably see some of these behaviors of distress, which that in itself is very pathologizing depending on who you talk to, that it's the child, it's the autism, which, as we know, it isn't the child and it isn't the autism. So that was a big one. But the other really big one was less social support. And this wasn't actual support, it was perceived support. So how much they felt they were supported. So you might have lots of people around you supporting you, but it's how well you perceive that you're being supported was actually the thing that led to the higher traumatic stress, like that relationship. So that one, and also interestingly, we're only just getting up to date with the traumatic stress of autistic people. We know that adults with autism or depression or particularly autistic adults, experience higher levels of trauma, depression, anxiety, stress. And so what we're finding in this research is also that autistic parents, if you're autistic, then you're more likely to experience parenting related trauma. So that makes you more vulnerable, which again, you know, the apple sometimes doesn't fall far from the tree. As a, you know, a parent of an autistic child, there's more chance that you're also going to be autistic if you know it or not. So they kind of go hand in hand. So I guess like if we're summarizing, the biggest predictors of trauma in parents is the sleep, the child-related challenges, and the limited support, and the parent being autistic themselves. So those are kind of things that if you like, oh yeah, check, 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 it's kind of like, okay, well, we need to be very careful with you. We need to be, you know, tender loving care. So those are interesting to know as well. But I guess that's kind of where our research is kind of left off. And there's many more things that we want to do and want to find. But I guess in summarizing it, we found that parents of autistic children are experiencing trauma-related symptoms around 4 times more than other parents. The DSM and ICD systems tell different stories. So the DSM includes PTSD, but only the ICD recognizes complex PTSD, which captures the difficulties with emotions, self-worth, and relationships that were really resonating with parents that did our study. Again, this is really interesting considering that you guys, the same as us in Australia, use the DSM. I am certainly steering clear of the DSM after this research. So I guess it's important that you know this too, because, you know, when you're being assessed or when your child is being assessed, it's good to know what system they're being assessed under. So, and I guess it's really important for us to know that longer term relational stress is the key thing here for us as parents. That's what we're experiencing, not the short term trauma that's like done and over, and then you kind of, you know, get through the aftermath. It's just ongoing. So we also saw that many parents shared experience that felt deeply distressing but didn't fit the official trauma definitions. So that means that parents can have real trauma symptoms even when those experiences aren't formally recognized in diagnostic systems. Um, and when we looked at what predicted trauma, again, the most strong predictors were sleep, child behaviors of distress, less social support, and having an autistic parents themselves played a major role. So I guess taken together, these results tell us that trauma in parents is really common. It's really multifaceted. It's not just about one event, but about the accumulation of stress over time. And for parents who recognize some of these signs or feelings in themselves, that awareness is actually like a powerful first step. I know working with many parents, like just kind of clicking into that, hold on a second, you are actually experiencing something that is quite significant, and it's not just you. It's not just you confabulating or making this bigger. So I guess if you're feeling super run down and you can't get on top of things and you're snapping and your relationships are falling to crap and you just kind of don't feel like it's the usual depression and anxiety, you may be surprised that you might fit this picture too. So I guess like when we're looking at this, what does all this results mean for you right now? Like it's a lot. So I guess validation is the main thing here. Like if you've ever felt that it goes way beyond the exhaustion and the worry, hopefully this research might help explain why. So parents of autistic children often carry an invisible load because so much of the focus is on supporting the child. So what these findings really show is that your challenges are real and measurable and that they do deserve to be recognized. And we found that many parents experience trauma-like symptoms, not because their child is autistic, but because of the constant stress and the judgment and the lack of adequate support within the systems around them. And that this isn't a reflection of weakness or failure. It's basically a reflection that the systems aren't meeting you or your child's needs. And I guess my hope is that this research not only validates your experience, but also helps to open doors to better trauma-informed support, because you deserve care and understanding too. So I guess next, I want to share some things that might help if you're in that situation at the moment and you're kind of not quite sure, what do I do? Sometimes I feel like if you're having that aha moment, some time to just kind of sit and think about what it is that's gone the aha. Because I know as parents, we kind of have to act really fast. Like, the child's having something going on, we have to, put the things in place. We have to explore, we have to get the next things. Sometimes for us as parents, it helps to draw a breath, and it just, even though we don't often get time to do that. So I guess in most trauma therapies, the event has already happened, the threat is over. So the focus is usually on processing what has occurred and moving on towards healing. But as I sort of mentioned before, for many parents of autistic children, the stresses are just ongoing. They don't stop. Um, the demands, the worries, the system challenges, you're faced with them all the time. And you still have to keep showing up and caring and advocating, even while your own nervous system is exhausted. So that kind of means that therapy and support need to look a little bit different. Instead of focusing purely on the moving on, it's often about giving your body moments of respite. So, and a lot of parents, when I bring this up, it's like, ha ha, that's very funny. So short, and then we're talking about sort of short pauses that help calm the nervous system, even if the stress itself can't be removed. So I guess when parenting feels overwhelming and when your child is really distressed or things feel really out of control, or having the right supports that work on a body level can make a real difference. So what does this mean for you right now? What I might do first is I'll give you a kind of list of trauma-informed therapies that I have found really helpful in this context. And you might have noticed that I said body, working with the body. What we know about trauma is now that, and particularly as parents, we live up in our heads. We're very analytical, we're thinking through everything, and that's, an anxious brain. We need to prepare for what's coming next, we need to be hyper vigilant. It's thinking, thinking, thinking. But when you experience trauma, it actually hits you at a body level. So when you think, you try and think you can think your way out of it, it often actually makes the body even more hypervigilant, which is not something that we want. But it kind of, we get into this automatic pattern of, if I just think about it, if I just go and sit with it or problem solve, it will get better. And we often find that the body is the one that tells us that we're exhausted. Our muscles ache, our head hurts, we just kind of feeling exhausted. So in terms of trauma support, the best support that if you're looking to get therapy, the best kind of supports that you can find for ongoing trauma that isn't over is the somatic body-based EMDR treatments. So they're what's called bottom-up therapies, because they don't work on just changing your thoughts. A lot of research about autistic brains. If you are autistic yourself, we have different brains that process anxiety and worry differently. So basically, the normal approaches to treating anxiety will not work for us. They just don't work. We will go round and round in circles, because that's just the way that we process information. And so changing the thoughts doesn't really help. So what we need to help our bodies do is to help them feel safe, even if it's just for micro moments. It kind of causes a little bit of a short circuit in the brain, and it kind of changes the route. So the things like EMDR, like in a nutshell, I'll just describe what some of these are. If you're not familiar, if you are, that's great. EMDR is basically it helps the brain to reprocess distressing experiences in the body so that they lose their emotional intensity. Somatic experiencing gently releases stored tension through the awareness of physical sensations. So it's like tapping into what your body is feeling at any given time. Trauma sensitive yoga. I know this is kind of like a lot of people like yoga is like a bit woolly, like whooshy kind of thing, but it kind of, if anything that you can get out of your head and focus on movement and breathing to reconnect safely like with the body is also going to, even if it's just like a one yoga pose that you can do, that short circuits the brain and gives it, like, connects you back into your body. Because basically when you're in trauma symptom mode, you're not connected to your body. It's all your head. So the next one would be like the sensory motor psychotherapy, which kind of combines a bit of body awareness with talk therapy. And so it kind of integrates the physical and the emotional experiencing. And deep brain reorienting is a new one. I think there's actually a lot of research coming out of the US, which has been really interesting about this one. And it basically helps release deep automatic threat responses that you hold in your body. So each of these approaches works to reset the body's internal alarm system. And even if it's just for brief periods, the mind can then have a different way. It's not going to solve your problems, but it's going to give you those short kind of like breaks that you need to sustain the journey through the ongoing stress that you're experiencing. And so these are just the other ideas are sort of parent groups, which you guys are all here, so it's lovely to see that you are connecting with your fellow parents, and even like attending sort of like online webinars, podcasts, things like that that can kind of expand your understanding, that can help. So I guess without saying, a lot of us parents, is something that I've noticed is that we think we can just push on and manage these symptoms alone. Um, it's not the case with trauma symptoms. They don't manage themselves alone. So I guess if you are recognizing in yourself that you are feeling these things, I would really strongly consider reaching out to a GP, or a psychologist or a psychiatrist, because I guess like when you do this, I would also try and find someone who's trauma informed, neuroaffirming, and understands neurodivergence, and most importantly, someone that you can feel safe and comfortable with. Because I guess not all doctors and clinicians will get it, but those who do are worth finding. And of course, like, therapy isn't always accessible right away. I don't know what the wait times to get in to see someone in the US are, but here in Australia, it can take some time to get the right person. And I strongly advise you to wait until you get the right person, even if it's someone that's not on that list, whether it's a social worker, someone that you feel you can connect with, because it's worth having that person. Um, Definitely worth having that person, to kind of help you navigate what potential therapy or support that you need that's more formal. Um, we don't have to figure this all out for ourselves. Like, and then if you have someone that can take care of that side of things, you have more space to focus on your parenting, rather than also treating yourself for symptoms. So I guess like that really probably isn't a big lot of help for you all. So what I want to move on to is just a few simple body-based strategies that you might use yourself. small things that can help your nervous system find moments of calm, even when you're in a really horrible, stressful situation. Um, so this one's highly overrated. It's one of the easiest things that we can do, but I don't know, even I don't do it sometimes, and it's like ridiculous because here I am talking to you about it. It's a like the self-soothing touch, and there's actually a lot of research about this now, which is mind-blowing. It's as simple as like just like rubbing your arms, like in a kind of loving way. Like you might just do that. And what happens? I already feel it already. It's ridiculous. The like the rush of oxytocin, it the body thinks that somebody is hugging you. It doesn't know that it's just you giving yourself that loving touch. So it's kind of like really like this one is like crazy quick. And all you need to do, maybe not if you're like in public, because unless you're in a cold place, it might look a bit weird if you're rubbing yourself in public. I probably wouldn't recommend it. So that one, a lot of research behind it. It actually helps release oxytocin, and that we know is linked to bonding and calm. And that immediately will lower your stress hormone, and it steadies your heart rate, brings your body back into balance. So there's that one. There's also like a lot of people, as you can see in the slide, just holding your hand over your heart is a good one, or even just giving yourself a gentle hug. Like it's like those things. Like this is a body-based one, right? I mean, your brain might still be going crazy, but at least you're kind of like giving your body that sort of somatic input. Um, some other ones which I've found work for parents, like if you've got two parents in the house, which is great. I know a lot of us are, single parents as well. But if you do have like a supportive partner at home, what I found like in those kind of ongoing stress situations is to have a discussion with them, like what are little things that we could do for each other in the moment that perhaps lower like the stress, lower the heart rate, and for example, one parent, like mother and father that I work with, we worked out that just kind of the father coming and putting the hand on the shoulder of the mother, like while the child is having a difficult experience or a meltdown, just that act in itself, putting the hand on the shoulder, you're both still there present with the child, but you just that those simple little acts can kind of help calm your system. So it might be that. It might be like making a routine to have a kind word to each other at the end of the day or the start of the day, and putting a reminder in your phones to do that, whether it's by text. I know some people have really busy lives, so you have to communicate these things like by text, or reflecting at the end of the day on one thing that the other person notice showed courage. And it could be something simple like, I spilt the milk on the floor and like you cleaned it up for me, or something really simple, and I really appreciated that. Something really simple. And if you don't have a partner that can do that for you, perhaps having a close friend, or even yourself, just getting into putting a reminder in your phone to make yourself do that. It feels really hard to do that when you've had a really tough day, but it does have the ability to kind of shift your mood state in that moment. So I guess I don't know if any of you are familiar with like EMDR. Um, when you engage in EMDR therapy, one of the things that we do in EMDR is it's called the butterfly tap. And it's basically, this is another one it's really powerful self-regulation exercise that can help calm your nervous system and bring balance when you're feeling tense or overwhelmed. So if you're feeling brave and courageous, um, I want you to see if you can do this with me. So basically just cross your arms so that your hands gently rest on your upper chest or your shoulders. Um, kind of like you're giving yourself a light hug. And then you just slowly tap each side left to right at your own gentle pace. The slower the better. But just try and keep a steady rhythm. That's it. And as you do this, you might sort of start to notice that your breathing slows down or your body starts to soften a little. And I guess what's happening here is that this rhythmic tapping kind of activates both sides of the brain. It's what we call bilateral stimulation, and it helps the body shift out of that fight, flight, or freeze mode. It's like basically it's sending a message to your nervous system that says you're safe right now and you can breathe again. And if you're doing this practice can be even more grounding if you bring to mind a place where you feel most relaxed. So if you do have like the mental imagery, if you can access that, finding a place, whether it be like a quiet beach, a forest, even like your own bed, and you can do it even if you're not at home in your bedroom. And I always find for myself it's even more powerful if you attach it to like a really simple mantra like I am calm, I am safe, I'm doing my best. Like those, pairing that the butterfly taps with a simple mantra and like a mental imagery of a place where you can really just kind of connect to. Again, it only takes a couple of seconds to do this, and it's a small thing. But I guess like small things, when you do them consistently, they can have a big impact on how your body hold and release stress. So that one might be, again, experimenting. It might not be for you, it might be something else. That one is one that I've found a lot of parents, once they get the hang of it and feel comfortable doing it, it really does sort of lower that arousal. Another one, again, like these are just food for thought. I'm mindful we've still got a bit of time, almost there. You've been very patient. I can't imagine what time it is and you're all probably very tired. So this one here, it's bringing to mind something, particularly if you've got a child that has a lot of meltdowns. This one I found, if you take a moment, like when the meltdown's kicking off, just to bring to mind a powerful protective image. It might be for a lot of parents that I work with, it's their mother, or like wishing that they had a mother there to mother them while they're trying to mother their child. But if that's not it for you, it might be, a pet. It could be a fictitious character. It could be your own personal bubble of protection that you can just imagine yourself in, and it kind of creates space for you in your brain. Because like, I don't know about you, but if you've got a screaming, crying, aggressive child, your system will react. Like it's just human biology. Basically, we react against each other. So there's some research that shows that if you can imagine this kind of a presence, like a positive presence, it can really trigger a sense of comfort and strength in your body. And it's almost, sometimes some parents that I know use this, sort of say that it's almost like that thing or that figure were really there with them. This is almost like, also if you're religious, like using whatever your religion sort of is the focus of, bringing that into that parenting moment. And while you're doing it, just maybe taking a breath, imagining that figure beside you, calm, steady, and reassuring. And I guess even when no one else is there to offer a hug or a helping hand, your body has its own built-in ways to find safety and grounding. Like we can do it ourselves. It's always nice when you have someone else there to help, but often, I don't know about you, a lot of the time the female is the kind of can be the more grounded. The male, if you're in a male partnership, sometimes just like, whoa, I don't know how to do this. So like I guess as an added benefit, when you use these calming strategies, like taking a breath, using the self-soothing touch, bringing to mind the supportive image, like the best part about this is that your child is actually learning at the same time. Like you're modeling what is calm, what you do in moments when you're overwhelmed. Um, they're going to learn, they're going to notice, and they will absorb your calm. So it might not happen straight away, but like over time, like developing these micro strategies, um, I've found a lot of parents have found that that's kind of the best way to kind of regulate, co-regulate with their child, and get their child to co-regulate with them. Um, and I guess the last one, which we've kind of already touched on, um, when things feel especially hard, again, one of the most simplest yet most powerful tools we can use is our own voice. So the way that we speak to ourselves, which I know a lot of this stuff is body based, but I know if you're anything like me and a lot of the parents that I work with, we are very analytical. So it's all thoughts, and like we won't even know probably half the time when our thoughts are just kind of our worst enemy. Telling us that we can't cope. This is horrible. Like I don't know if I can go on. Like those thoughts that you get coming. I have no one to help me. Those sort of thoughts, they really do challenge your system. So for many of us, the challenges don't end when the day ends. The stress is ongoing, and moments of calm can feel few like and far between. So I guess in those times, having a self mantra, I don't know if like this can be very personalized. And I sometimes have one and I'll change it each week because I don't know about you, but I get bored with with the same one. So you can have a few kind of grounding phrases that can act like an anchor. So I guess like a self mantra, it reminds you that when you're like what you're feeling makes sense. We don't want to do the whole let's just slap a happy face on it and pretend it's okay. The best kind of mantras that work are the ones that are real. So, like, yeah, this is really shit right now. Like, I don't know anybody that would be doing anything different or coping any better than I am right now. So what you're doing is you're recognizing, you're validating that, yeah, that's just it's just not I'm not enjoying this. And that in itself kind of shifts that from being like really, it's like, okay, it's the elephant's in the room now. I'm letting it out. And it can kind of help your body calm down because it's like I've been seen, even if it is just being seen by yourself. And you can shift that kind of inner voice from the self-criticism to a bit more compassion. Um, because we do a really hard job. Like nobody sees what you do, except you and your child sometimes, but mostly just you. So I found that this one is a really good one. So take it, do with it what you will. It might be a bit long-winded. You can shorten it. I sometimes, if you're anything like me, I forget them really quickly. I have them written out and stuck somewhere, like in multiple places, like in the car. Um, Not to be reading while I'm driving, but just sort of, when you're in there, because you spend a lot of time in the car driving kids places, in the bathroom, even on the back of the toilet door. But probably a lot of you don't get to close the toilet door, so you probably wouldn't see it there. Um, So I guess and it's just kind of that process of just kind of giving your brain something else to focus on rather than the internal like battlefield that you constantly have going on. Because um it's really difficult being in that battlefield. So I don't know if you've got one yourself, you might have one. I'd love to hear them. It's again, it's just kind of way of I'm doing the best that I can, and that's enough for right now. Like it's just simple. Um, Again, they don't get rid of the challenges that you're facing, but they remind you that you're not alone and that these small micro moments of care and calm, they really do matter, even if everything else is kind of overwhelming most of the time. So that, I guess, pretty much brings, I know it's like, what's our time like? Are we going okay? Is everyone still there? It's very quiet.
It's-
We're here.
we
Oh,
are.
good. Phew.
We've had some comments in the chat, and I'm sure we're getting questions coming in as well. So
We are. So Kylie, if you want to unscreen share, then
yes.
you'll be able to see us better.
Oh, great.
And I have to say, I've been sitting here. It's probably good that I've been muted because I've been like chiming in.
Oh, great. Oh, what
As
a
I've been
shame. I would have
listening.
loved to hear that. It's really unnerving, like when you're talking
Same.
and then it's just quiet.
You wouldn't have wanted to hear some of the words that were coming out, so it's all good. And if other folks, if you want to turn on your cameras, you're welcome to, no pressure if you don't want to. We did have questions coming in. Kay, do you want to jump in with a few of those?
For sure.
Okay.
I will say, like, so this has been amazing. I could probably give you about 30 questions just of my own, just to help guide my brain. But one of the questions, I know you talked about the different emotions. What about the emotion of grief and dealing as a parent? Grief of what could be, was, the pending doom thoughts, like what, how does that role fit in with the emotions that come with this PTSD and managing when we have our kiddos?
Yeah, that's a really good question because I think one of the like the conclusions of my PhD thesis was, does PTSD and trauma basically sum up the whole picture? Does some of that, is that actually, because there's a lot of grief related difficulties as well that you have as parents. And I think, like, if I'm honest, like a lot of the parents that I see are actually struggling with that shame also related to the grief that they're feeling because they would have wished that their child didn't suffer like they do and that they didn't suffer as a parent like they do. And to say that out loud is very shameful for a lot of parents because like it's just not something that is accepted. But there's definitely research to support that parents, that grief is one of the things that they do feel and they do experience. And it's kind of like described as losing a loved one. So it's that intense for some parents. So working through that, and it's kind of like really hard when you have to like classify what is the label we're going to give to this parent to describe their symptoms. It's often that I don't feel like you can often give a neat little label. Like I kind of feel like sometimes it's like, yes, there is trauma symptoms, but there's also this grief picture that, a therapist would need to be mindful of and work within a grief kind of modality as well, because it's not, as you're saying, it's really complex. It's not just one thing or the other. It's like this with a flavor of that and some, flavors here. Like and when I see parents, it's like, okay, what flavor is most present today? And what has been the flavor that you've been experiencing most this week? Because as we know with grief, the tide will come in and the tide will go out. Like you'll have really good days and you'll feel like, yes, I can do this, and things are going fine. And then all of a sudden you'll be smacked down on your back with these overwhelmed feelings of like, I can't do this anymore. I want the child that I wanted, and you're not the child that I wanted. And then you kind of have that, you know, secondary like overwhelm of shame, because like you're the,
Mhm.
and even though you love your child like anything else, you have this overwhelming experience that you shouldn't be feeling this way. And that's worse than the grief itself. So I don't know that that answered your question, Kate,
It
but for
absolutely
whoever it
did.
was.
That was a me question. And yes, it did.
Yeah.
Thank you very much. Diane, I see your hand up.
Yeah, one of the things that I just wanted to throw in here, and I hope you don't mind, Kylie, is that in work with my own therapist and dealing with some of this stuff, one thing that's been, it sounds so simple but revolutionary for me, is realizing that you can hold multiple feelings at once. So
Yeah, it's
you
crazy.
can, and I don't know why that blew me away, but the idea that I could feel grief and joy, I could be angry and loving, like I could, like I could have complicated feelings that seemed in contrast to each other, and
Yeah.
that's okay. And in a weird way, it was comforting, because anytime I felt a negative feeling, I would feel like, again, like that shame, or that I was a bad parent, right? And so knowing that that doesn't wipe out all the positive things I feel. Does that make sense?
Yeah, that's right. And you know, while you're talking, Diane, I'm kind of thinking like how like crappy sometimes like our the wiring of our brain, where we, you know, constantly paying attention to the threat rather than, you know, noticing and, you know, reliving the positive, happy times. Like it's just, and I guess, you know, evolution explains that we need to do that to be able to survive. But unfortunately for us, I think we've evolved so much that our brains actually are more powerful to tip us towards the threat, which, but what you're saying, Diane, about the holding multiple emotions, that is a very um uh that's an experience that I have also shared as well. And it's kind of like that mind-boggling experience when you're like, what? I can be more than just one or the other. I can be in the gray zone. It's like, no. So yeah, that, and it's very actually it's a very neurodivergent way of thinking. Like that, yeah, I can only be one emotion at a time. No way. Like that, yeah. So really interesting.
Well, we also have some other questions that were dropped on the form.
Hey, you want
Let's
to start
see.
with the highlighted one there?
Okay, I can do that.
Okay.
Can you say more about what I think is commonly called CBT and why it didn't work for this population? I've had at least 5 therapists try this with me, and I give it my all, but it doesn't work.
Yeah. Yeah, that's funny. I've heard that too. And like I think for a lot of us therapists, we go through and it depends on which institution you go through. Like CBT is often the bread and butter of like, this is the way to come becoming a therapist. You learn CBT, and but CBT is actually so diluted now. We don't actually know what is and what isn't CBT. And particularly CBT isn't effective for us, and more so for autistic brains, is because it's very much focused on what we do well. Like we analyze things really well. Like we're very cognitive. Our anxiety is cognitive. Like it lives up in our brain, and we can think about it, we can code it, we can systematize it, we can, you know, it doesn't get to the root of what our actual experience is, which is in the body. And for a lot of people, that disconnect between the brain and the body is the thing that perpetuates symptoms. So if you're only doing a CBT approach, it's not really going to help your feelings of anxiety and overwhelm and stress, because for autistic people, particularly, I can speak for, we live up in our brains. So it's our playground. but we don't necessarily connect with our body. So if you're wanting to decrease your feelings of anxiety and stress, you have to build the bridge between the body to the brain. And a lot of us don't like doing that because it's experiential and it involves doing things that put you outside of your comfort zone, like yoga and like, EMDR, which can be really overwhelming for people who just want to sit and talk about their experiences. So building that connection between your bottom up, like your body to your brain, which the brain is the strength power here, but the body for a lot of us gets left behind. And that's where the trauma and anxiety and stress is stored. So that's potentially why cognitive behavior therapy doesn't quite fit us. So I hope that answers the question.
Yes, thank you very much. Let's see, we have another one. Have you looked into how parent aging and menopause factor into this? The sleep predictor makes me wonder about a connection.
Yeah, that's like so awesome, that question. And like our research didn't look into that, but I know that there is a lot of research coming out about menopause and perimenopause and just how that adds another layer of complexity into the mix, especially um, noticing that in our research, a lot of the parents were in their 40s, like 40s and mid 40s, which I was surprised about too, like people having babies later. And so getting closer to that perimenopausal like phase when you've got kids that are kind of in that sort of meltdowny kind of behavior range. So dealing with that on top of perimenopause or menopause, I can't even fathom like what these parents would be experiencing, like just on a chemistry level. And
Oh, it's
that,
fun.
It's
oh my God,
absolutely
I'm
fun.
like,
It's
Michelle,
the
like,
wildest ride you could ever take.
but yeah, that is such an interesting question. And no, we didn't focus on it, but oh my gosh, my mind boggles at what this would mean for you, like on top of everything else. So I
Yes.
can't give any any insight to that one.
Thank you for the insight, but I can guarantee you it's a ride and a half.
Oh my
Let's
gosh.
see. One of the other questions that we have, how much time do we have? We have a couple minutes left. Let's see. Is the ICD created by a committee like the DSM is?
Yeah, the ICD is actually, I should mention that, is the World Health Organization. That's their diagnostic manual. So it kind of like, I mean, I kind of the DSM is American basically. So, and we Australians, we follow anything you guys do. So I kind of actually feel that the ICD would, we should all just adopt like a world kind of approach to disorders and diagnoses. So yeah, World Health Organization is the producer of that.
Sorry, I was still muted. Okay, well, thank you for that clarification. So there's another question here about the DSM. Is there an effort for the DSM to be updated to include complex PTSD?
Oh, that's another spicy question. Yes, well, that's what I assume that they will have to, because there's just so much contention about the PTSD diagnosis at the moment. And I know like Bessel van der Kolk, like himself, he has tried to like change diagnostic like in terms of trauma in the DSM, and he built up a big range of evidence and it was rejected. So in terms of this PTSD stuff and complex PTSD, I think definitely like that's definitely something that they're going to have to consider with all the research that's coming out, just being like, this doesn't fit. So I hope that the next edition will consider that, but I don't know what they will do.
Fingers crossed.
Yeah,
Fingers crossed. That's
for
a
both of
great
our
comparison.
countries.
Yes, for sure. Let's see. We have another question here. If a parent is not being taken seriously by a mental health provider, if the provider doesn't seem to be recognizing the weight of the parenting demand, is there any specific language that is there a suggestion of language that a parent could use to get the provider on board?
Oh, that's a good one too. I have often found that no, there isn't. Like, it just if a person is a provider, it depends who it is. Like, and it depends, like, if you have a good relationship with the person overall and you feel comfortable with them, but they're just kind of slow to this like trauma piece, then it might be worth just sort of I would actually, I've got some parents that see psychiatrists and I've got them to fill out like an ICD trauma questionnaire, and I've sent that with them to the psychiatrist. It depends who it is. Like if I was working with a parent, I would advocate for them, like speak to whoever it is. Like usually it's more medical people that don't accept like GPs and psychiatrists. Psychologists I've found are more sort of open. Um, so it depends on who it is. I would sort of, because you can get the screeners online, like and I'm more than happy to send through anything that if some parents are wanting those, you can get the screeners and you can do them yourself and take them with you to your GP and just sort of say, this is what I'm experiencing. This is what I know. This like leads to, trauma. What can we do about it? Then if it doesn't work and the provider is still not accepting that, then yeah, I would definitely go somewhere else. Like it's too important to just sort of sit with it. It's just not, and trauma particularly, you're not going to get any resolution. It hits the body harder than stress, anxiety, and depression. It's not worth sitting with.
I agree. I agree. Thank you for that information and that guidance. And we have time for one last question. Any tips on handling school teams that gaslight you about your child? That's an
Oh
excellent question.
my gosh, the amount of school meetings that I attend and just have to remind myself to speak kindly and calmly. There's a lot of difficulties in school systems. So it's really hard. And it depends on what sort of system the school it's I have, look, to be honest, I'm going to be totally honest. I haven't had a lot of success, and it's usually because like what comes from the top is how the rest of the school functions. Like if the principal or the head of the school is like just not open to making accommodations and support, then you're not going to get anywhere. Like it's just as simple as that. Um, a lot of the kids that parents that I work with, we've either had to change schools or look at alternative schooling because like it all links back to the child's behaviors, right? Behaviors of distress. If your child is having these behaviors, the parent is not coping. And often it's like the behaviors are happening at home, so the school doesn't know, but it's like, and when the parent comes to the school to ask for support and consideration, they're met with, well, you must be doing a really crappy job at home because we're not seeing this at school and you're hanging on by tenterhooks. And they won't put anything into like action at school. It's you kind of got to pick and choose your battles, because if you're experiencing complete burnout, stress, anxiety, depression, trauma at home, fighting the school system is not going, especially when it's coming from the top, is not going to get you anywhere. And fighting that battle, it's easier to say go somewhere else. You're just not going to get anywhere. Like it just doesn't work. You need a whole army of parents and clinicians to support in the school to make any change. And if you're a one-man job fighting for your child at a school that isn't listening, then it's draining your reserves. And I would seriously consider what the other options are. Because schools and parents advocating is one of the most difficult things that I have to work within as well. So, and the best way is to either get out or find something else that fits better. Not
Yes,
an easy
indeed.
answer.
It's not. It's a hard one, but it's one that we definitely all have faced at some point in this journey. Some are still in the midst of it.
Yeah.
So we appreciate your words on that. Michelle, Diane, do you guys have anything before we close out?
I want to say thank you very much. I find the research to be fascinating, the parenting tips and suggestions incredibly helpful and simple to employ when you practice and remember to do them, which I think is the hardest part.
Yes, agreed.
And something that I also really appreciated, I put in the chat earlier, is the way that you phrased repeatedly, it's the system that isn't fitting with the child, as opposed to the child or their behavior or the autism being the problem. And I think that for us as parents to model that language with our school teams can also be really valuable.
Yeah.
I mean, it's not necessarily going to change the system, but if it helps the school staff recognize what's going on, I think that's a step in the right direction.
For sure.
Diane, do you have anything you wanted to throw in at the end there?
Oh gosh, I could just keep talking for hours about this
I
stuff.
know.
But I want to thank you so much for coming from halfway across the world to share with us tonight. I think it's been really great. It's been really helpful for me, and I think it'll be really helpful for a lot of our parents. I think one of the things we talk about in this organization, because we cover all kinds of disabilities. While your presentation is focused a lot on parents of autistic children, I actually think that this applies to so many kids with disabilities, both developmental, but as well as physical and medical. I know that there's work out there about complex PTSD for parents of kids who are medically fragile as well, people who spend a lot of time in hospitals. So I just think that I really appreciate this work. I find it fascinating. I would have about 1,000 questions to ask you, but I so appreciate your being here. Thank you so much. Yeah.
Thank you so much for inviting me. It was wonderful to share with you. I hope it sort of gave you a few interesting points and tips, and I guess I'm more than happy for anyone to email me, and if there's anything that you want follow-up information on, please do reach out. I'm more than happy to share anything that might help or assist.
Thank you so much.
Absolutely. Thank you again, Kylie, for sharing your wisdom. Your heart, and I mean you're doing the hard work. You're doing the hard work, the research, and being able to share it with us. Thank you for joining us from across the across the globe. We really appreciate it. So for everyone else, tonight's conversation has reminded us that parenting, especially in complex terrain, is not just a role, but a revolution of love. To every caregiver that's out there, your strength is not measured by perfection, but by presence. And that's something that that's along the lines of the mantras. To keep in mind. Your story matters, your joy matters, and your resilience is a quiet roar that reshapes the world. May we continue to hold space for each other, speak truth with tenderness, share your knowledge, and build communities similar to this one, where every family feels seen, supported, and celebrated. So thank you everyone for joining us tonight. Thank you again, Kylie. Thank you, thank you, thank you. Super excited. So when you start seeing these emails come through,
Yeah.
just know that you have left a lasting impact. With that, I guess we can go ahead and close out the event. Thank you, everyone. You can look for email out for suggestions of other topics for a fireside chat